Oxygen saturation. In midst of the COVID-19 pandemic, oxygen saturation levels, as a vital parameter, plays an important role in patient management. Oxygen saturation is the fraction of oxygen-saturated hemoglobin relative to the total hemoglobin in the blood. Normal arterial blood oxygen saturation levels are 95 to 100%. Oxygen saturation can be measured with various methods. Partial pressure of oxygen is assessed with an arterial blood gas test. Peripheral oxygen saturation is assessed with pulse oximeters. A comparison between the both is shown in the presentation. Pulse oximetry is used for monitoring oxygen saturation, which is an important vital sign. The device uses LEDs of different colors to measure the absorption of red and infrared light in the extremities. The difference in absorption between oxygenated and deoxygenated hemoglobin makes the calculation possible. Pulse oximeters come in various forms, such as finger pulse oximeter, handheld, and tabletop oximeters. The preferred site of usage is the fingers. In pediatric patients, it is strapped onto the toes. Usage of pulse oximeters on the earlobes is unreliable. In cases of severe mutilation of the extremities, it can be considered. The waveform assists clinicians in distinguishing an artifact from the true signal. Normal signal shows sharp waveform with a clear dichrotic notch. Low perfusion shows a typical sine wave. Pulsatile signal with superimposed noise artifact gives a jagged appearance. Motion artifact shows an erratic waveform. The normal oxygen levels in a pulse oximeter usually range from 95% to 100%. Levels below 95% is considered hypoxemia. The brain gets affected when the SpO2 level falls below 80 to 85%. Cyanosis develops when the SpO2 level drops below 67%. The advantages of pulse oximetry is that it is non-invasive and quick, whereas the disadvantages include that it cannot assess oxygen perfusion and adequacy of ventilation. Oximeters have limitations, which may result in erroneous readings. Occurs when there is an elevation of dyshemoglobins, such as sulfhemoglobin, methemoglobin, and carboxyhemoglobin. In other circumstances such as pigmented skin, presence of nail polish, and use of intravenous dyes. Hypoxia is caused due to extremely high altitude, decreased capacity of the lung to take in oxygen, as in asthma, COPD, interstitial lung disease, and viral infections such as COVID-19. Decreased capacity of the heart to supply the oxygenated blood back to the lungs, like in congenital heart disease. Other conditions include sleep apnea and smoking. Hyperoxemia is generally detected using ABG testing and is defined as blood oxygen levels above 120 millimeters of mercury. This is mostly seen when patients are exposed to high pressures of supplemental oxygen for prolonged periods. To get more such high-yield medical content, don't forget to subscribe. BasidiaMED. The easiest and fastest way to take advanced clinical history.